Hello, everyone. My name is Shelley Kundick. I am a clinical educator with Archer Review, and I am excited to be here with you today for what we call a Rapid 30. For those of you that haven't participated in a Rapid 30 before, we are just going to go through as many NCLEX practice questions as we can cover in the next 30 minutes. We'll be talking a little bit of content, a little bit of strategy as we go through those questions. I would love to have your participation, so feel free to put those answers in the chat, and it helps me kind of know how you guys are doing, and if you guys have questions, you're welcome to put those in the chat or the Q&A as well. So let's just jump right into it and get started with question number 1. All right, the emergency department nurse is caring for a client with a hypertensive emergency. The nurse should obtain a prescription for intravenous what? All right, so there's your question. Give me your answer choices, and then we'll discuss the answer in just a moment. All right, we're seeing some good answers. It looks like most of you are kind of back and forth between 2 answer choices. So we will make sure we discuss both of those and make sure you understand why the correct answer is correct. So if we have a client who's in a hypertensive emergency, the medication we would expect to be prescribed for them would be nicardipine. Let's talk about why that's correct. Nicardipine is a calcium channel blocker. And if we give that via IV, it's going to help lower blood pressure during a hypertensive emergency. We often see it administered in the critical care setting when they're doing frequent blood pressure monitoring, and we typically administer it with a pump. And so a couple of important things to remember about nicardipine. Let's talk about these other answer choices and make sure we all understand why C is correct and why the other ones are not. A, dobutamine. This is not used as a hypertensive for hypertensive emergencies because it helps increase cardiac output by increasing myocardial contractility. So it's going to help the heart failure, not so much in a hypertensive emergency. With B, digoxin, I didn't see anyone pick B as the right answer. Maybe someone did, but it is less popular due to so many drug-to-drug interactions that need to have close therapeutic monitoring. Digoxin is typically used for individuals with heart failure or AFib, and not typically in a hypertensive emergency. I did see a lot of D answers, so let's talk about this. D is an antiarrhythmic medication that treats ventricular tachycardia, VFib, AFib, that sort of thing. It has lots of different uses, and it is used for cardiac, but it is not used in hypertensive emergencies. And so it doesn't have that primary action of vasodilation. All right, so hopefully that makes sense. Hopefully you all now understand that nicardipine is the correct answer. All right, let's move on and let's look at question number 2. The nurse is reviewing Hirschsprung's disease with a group of nursing students. It would be appropriate for the nurse to identify the primary treatment as what? All right, look those answer choices over. Let me know what answer you would choose. All right. Looks like I've given you guys some good time to answer that question, so let's discuss it. The strategy I would take in answering a question like this, I need to look for those keywords. Hirschsprung's disease. I am looking for the primary treatment of Hirschsprung's disease. I need to know what Hirschsprung's disease is before I pick a primary treatment. And so anytime I have a question like this, I'm going to define what that condition is. Can anyone tell me in the chat, what is Hirschsprung's disease? Just as briefly as possible, what does that mean? Anyone know? Yeah, they are missing nerves in the colon. there's a section of the colon that doesn't have nerves running to it, and so it's not able to perform peristalsis and keep those stools moving. And we are going to see this in our newborn clients, and it's something that needs to be repaired right away. And the correct repair for this is going to be a surgical repair, something like a colectomy. That is how they treat Hirschsprung's disease. And so that would be the correct answer. How they do that is they kind of cut out the portion that does not have those neurons, connect the other two portions together. It's often called like a pull-through procedure, and it allows the rest of that intestine to kind of bypass that portion that's not working so that that stool can pass the way that it should. All right, so that is the correct answer. Hirschsprung's disease, they're going to do a surgical repair to fix that. All right, on to question number 3. You guys are doing fantastic. The nurse is caring for a client with a basilar skull fracture. Which assessment finding requires immediate follow-up? All right, look that over. Give me your answers in the chat. All right, you guys are doing so good. Fantastic. All right, I'm going to take a similar strategy with this question. I have a client with a basilar skull fracture, and I'm looking for what assessment finding requires immediate follow-up. So the first thing I want to do is define what a basilar skull fracture is, and I'm going to think about what I know about it. What could that potentially lead to? What would be an emergency situation relating to that basilar skull fracture? And so the correct answer here, which lots of you chose, is C, a temperature of 100.9 degrees. What is that temperature indicating? Tell me in the chat, why am I so concerned about that temperature? The fever is a manifestation of meningitis. That's really what I'm concerned about here, is when an individual has a basilar skull fracture, they are prone to developing meningitis because there's that direct communication of cerebrospinal fluid with the ear and the nasal passages. And so that high fever, that fever indicator is that the client may be developing meningitis. We don't want to mess around with meningitis. So if we see that temperature rising in a client with basilar skull fracture, we are going to take action immediately because that could likely be a sign that the client is leading towards meningitis. All right, fantastic. Before we go on to another question, I just want to share with you guys one of the programs that we have here at Archery View that maybe you're not completely familiar with. We have a program called Intense Prep. Intense Prep is the #1 recommended package for repeat test takers. It's a package that first-time test takers use, repeat test takers use, international students use who maybe need just a little bit of extra guidance in their studies, along with students who maybe it's been several years since they graduated. They haven't passed, they're coming back and wanting to get that license. Intense Prep offers a very guided program to help you get to that point that you're ready to pass your NCLEX. These are some of the elements of Intense Prep. Just to kind of give you a little overview of what it includes. If you have questions about it, please ask because I am happy to answer them. And you can also scan this QR code, and that is going to take you directly to our website where it will give you all of the details that you need for Intense Prep. The first thing that's really cool about Intense Prep is we offer you a structured schedule. So you know exactly what to do every day. We have a 6-week study plan and a 10-week study plan. So when you sign up for Intense Prep, you will pick either the 6-week or the 10-week study plan. They all cover the same things. It's just the 6-week study plan goes a little bit faster, and the 10-week study plan goes just a little bit slower. If you want to take a little more time, maybe you're working full-time and don't quite have as many hours in the day to study, that 10-week study plan gives you a little bit of a bigger window to get everything in. The structured schedule covers everything you need to know to pass that NCLEX. We start out with testing strategies during week 1, and you will watch videos and you will attend lectures that will help you guide you through those testing strategies, how to answer SATA questions, how to do those unfolding case studies, what prioritization all about, what are those basic strategies that can help you rule down the answers and come up with the correct answer choice. So testing strategies are a big part of intense prep. Along with that, we do a lot of content review. Over the course of those 6 to 10 weeks, you will review all of the major systems and specialties and high yield content that you will need to know for the NCLEX. That's one reason this works great for students who have graduated several years ago, is it kind of guides you through everything so that you have a good review of everything you need to know. We provide you with learning activities. We have worksheets, case studies, skeleton notes, flashcards, cheat sheets, everything that you need to do that active recall studying to help you learn the information, understand it, and be able to use that knowledge that you've gained as you take your NCLEX exam. Of course, it includes access to our QBank. As an RN student, you'll have over 3,100 questions available to you to practice. Your schedule will point out exactly how many questions to answer every single day. Along with that, you also have access to our exit exam, you have access to the 3-day live review, and you have access to the pharmacology crash course. So this really is the all-inclusive package that includes all of the study tools that we offer in one purchase. Probably the biggest benefit and the thing that students will love the most about intense prep is the feedback videos. When you pick a cohort, you are assigned to one of our amazing Archer tutors. That tutor will be your guide over those 6 to 10 weeks. They are somebody that you can reach out to by email if you need a little support, if you need study tip suggestions, if you have a question about content that you're not quite sure about, your tutor is there for you through email to help answer those questions. And they also send you feedback videos. These feedback videos, you get 5 of them throughout intense prep. If you're doing the 6-week program, you get 1 per week. If you're doing the 10-week program, you get them every other week. Either way, you get a total of 5 feedback videos. They are personalized to you. Your tutor will do a screen recording of your QBank scores, and they will tell you, hey, here's where you're doing well, here's where you can improve, here's some recommendations for how to study in those areas you're struggling with. They will look at your readiness assessments and your CAT exams. They will let you know when you're ready to test. They will let you know what you need to do to continue preparing. So you get that personalized feedback regularly throughout that cohort time that you can learn and grow and improve your scores. And we see student scores increase amazingly. They get themselves ready. They start out in week 1 thinking they're never going to get there, and by the end of intense prep, they are oftentimes ready to go and ready to pass their NCLEX. Do any of you have any questions for me about intense prep before we jump back into our questions? Let's see, I have Kenzie in the chat saying that she loves intense prep so far and she highly recommends it. Someone else says they got the SurePass earlier this year. Yes, this is different from SurePass. SurePass includes our QBank, it includes our video library, it includes the 3-day live review, but SurePass and Intense Prep are 2 different programs. Intense Prep has it's a more all-inclusive package. Like I said, it includes all of those learning activities, it includes the exit exam, it includes the pharmacology crash course, the 3-day live review, and it has that tutor guided support and those feedback videos. All right, and so it really has everything that you need. If you are interested in getting more information about Intense Prep, you can scan the QR code, or you can reach out to our nursing email, which is nursing@archerreview.com, and I can reply to that and answer any questions that you have and help guide you towards signing up for Intense Prep if you feel like it would be a great package for you. All right, any other questions before I move on with some more rapid 30 practice questions? All right, I'm not seeing any more questions about Intense Prep. So I would love to see some of you join us in Intense Prep. And like I said, if you have any questions, please reach out and let me know. All right, let's jump back into a few more practice questions now. Question number 4, the nurse is caring for assigned clients. The nurse should initially follow up on the client who what? All right, we see that word initially. We know this is a prioritization question. So we are looking for which client is the most unstable, which client would die first if I don't intervene. So look those clients over and tell me in the chat who you would follow up with first. This is not a static question. Somebody asked that in the Q&A. This is just to pick the one client that you would follow up on first. All right, you guys are good. I think every single answer that I saw looks like you guys are picking answer choice B, had a craniotomy and has a change in the Glasgow Coma Scale from 13 to 11 in the last hour. That would be my most concerning client. If I look at which of these clients would die first or have the most serious repercussions, if I ignored them, this is the client that fits that. This is the most unstable client. That decrease in Glasgow Coma Scale indicates they have worsening neurological functioning. They went from a 13 to an 11. That is a pretty big drop in an hour. If that glucose coma scale were increasing, that would be a good thing. When it's dropping, that tells me that they require follow-up. We would want to do a rapid neurological assessment. We would want to notify the primary healthcare provider regarding that change because this is the client whose condition is worsening the most. Let's talk about why we didn't pick the other answers. A basilar skull fracture with bruises under their eyes. Is that expected or unexpected? Yeah, that's an expected finding. With the basilar skull fracture, you expect them to have bruises under their eyes. So when someone is having expected findings, we are less concerned about them. That would cross A right off the list. C, a client with ALS, with ALS who's requesting to have resuscitation efforts withheld. Clients with ALS have a poor prognosis. There's really no cure for that. Treatment is symptomatic, and so we start talking about advanced directives. We start talking about those things with a client who has ALS. And so this, once again, is something that would be very expected in this situation. And then finally, D, a client with Guillain-Barré syndrome who is reporting lower extremity muscle weakness. Once again, this is very much an expected finding. With Guillain-Barré, lower extremity weakness is common. That's part of what's expected for those clients. And so A, C, and D are all expected findings. B is the only one that is progressing outside of expected, that is becoming more unstable, and that requires our attention. All right, great job, you guys. Moving on to question number 5. The nurse is caring for a client in the emergency department who sustained a high voltage major electrical burn. Which lab data should the nurse monitor to determine if the client is experiencing a complication from this injury? All right, look those different labs over and let me know which one you would be focusing on. All right, hopefully I've given you enough time to look those answer choices over. And it looks like most of you are choosing A, which is the correct answer, those CK levels. Why would we be concerned about CK levels with someone who has received a major electrical burn? Why is that lab significant? What are we worried about during that burn? We're getting some good, somebody said muscles and somebody said rhabdomyolysis. You are absolutely on track with that. Great job, whoever said those great answer choices. Following a major electrical burn, the client is at risk of developing rhabdomyolysis. That's a muscular damage from that burn. And so CK levels are going to help us see how severe that muscular damage is. So that really goes back to the muscles. All right. What other labs would be important to watch in a client who had a major electrical burn? These ones are not high on the list, but there's a few others we'd want to be keeping an eye on. Someone said potassium. Yes, absolutely. That would be a really good one to watch. What else would help us know how well those kidneys are functioning? What's another lab we might watch for kidney function? The bun. Yes, we would keep an eye on that bun. Calcium is another electrolyte that would likely be thrown off a bit by a burn, and then the troponin levels as well. So, and that's going to focus a little bit more on the heart damage. But the CK, the creatinine phosphokinase, helps us know whether that client is developing rhabdomyolysis due to muscular damage. When those muscles break down, it releases that CK, and those CK levels go up. What organ is likely to be affected by a significant rise in CK levels? We're worried initially about those muscles breaking down, but yes, the kidney. One of the biggest effects of rhabdomyolysis is potential kidney failure. And so we need to keep an eye on that CK level, make sure it doesn't get too high. If it is getting high, we're going to flush fluids through them and get that down so that those kidneys do not go into failure. All right, a great job, you guys. That was fantastic. All right, on to question number 6. The nurse is caring for a client who is having a liver biopsy. Which positioning should the nurse place the client in immediately following the procedure? All right, we are looking for positioning following a liver biopsy. Answers are rolling in and they're looking fantastic. Once again, I'm going to define a liver biopsy before I try to answer this question. I'm going to think about what they're doing in a liver biopsy, where in the body is the liver located, and what position is going to be best for recovery following that liver biopsy. And any of you who chose B, right lateral, as your answer, you are absolutely right. What is it going to do if you have that client in the right lateral positioning? How is that going to be helpful after a liver biopsy? Yes, Nicole says apply pressure. Absolutely. When you have them on the right side, the liver is on the right side. So they are laying on that side where the biopsy took place. That basically puts pressure on that biopsy site, which helps reduce the risk of post-biopsy bleeding. We don't want them bleeding from that biopsy site. So get them on that right side. That's going to put that natural pressure on it and hopefully help reduce the chances of bleeding. All right, fantastic job. Let's move on to question number 7. The nurse is performing a continuing education course on newborn care and thermoregulation. Which of the following actions by the nurse will prevent evaporative heat loss in the newborn? All right, there's your question. Look it over and share your answers with me in the chat. We'll discuss in just a moment. All right, we are getting a nice variety of answers here, not a consensus on any one correct answer. This is one of those questions where you really need to pay attention to the specific words and make sure exactly that you know exactly what they mean. This is you're teaching a class on newborn care and thermoregulation, and we are looking for an action that will prevent evaporative heat loss. So evaporative heat loss is the key term in this question. There are different types of heat loss, and we need to make sure that we are focusing on evaporative heat loss. And so with that in mind, The correct answer here is answer choice A, drying the newborn skin with a towel after a bath. Let's think about why that addresses evaporative heat loss. The definition of evaporative heat loss is moisture from the body is lost due to the environment. That heat loss is being lost because, or sorry, let me rephrase that. Heat is being lost because of that moisture evaporating off the body. And so the best way to avoid that would be to dry them quickly after the bath, get that water off of their body, and it's less likely to cause evaporative heat loss. So that's why A is the right answer. Let's take a minute to discuss these other answer choices because I saw all of these answers and come up in the chat box. So let's talk about B, placing the infant skin to skin with the parent. This is a way of reducing conductive heat rather than evaporative heat loss. And so this is what's a little bit tricky about this question is this is a good thing to do, but it doesn't hit the qualification of evaporative heat loss. Let's look at C, warming the stethoscope before auscultating heart and lung sounds. That's a great thing to do. What baby wants an ice cold stethoscope put on their chest? But that is an effective way of reducing conductive heat loss as well. Conductive heat loss is when you have direct contact with something that's cooler. So you take a cold stethoscope, put it on a baby's chest, it can cool them down. If you warm it up, it's not going to have that conductive heat loss. All right, and let's look at D, keeping the temperature in the newborn care area between 22 and 26 Celsius or 72 and 78 Fahrenheit. This is an effective way to also reduce convective heat loss, but not evaporative heat loss. So we really need to understand those different words. If that feels a little bit confusing to you, take a minute after we finish up today to look those up. Look up evaporative heat loss, convective heat loss, conductive heat loss. Those are the three different terms we discussed with this question. Make sure you understand what the difference is between all of them. All right, let's move on. Oh, actually, that was our last question. I thought we had one more on here. I apologize, that's all we have. So we are done with our practice questions for today. So hopefully you learned a little something there. Maybe got a little content review. Maybe got a little strategy review. If there's something we talked about today that felt a little confusing, that's a great indicator to go look it up and make sure you understand it a little bit better moving forward. I just want to remind all of you that Archer Review is here for you across the nursing lifespan. We start out with pre-nursing in Archer Review. We help guide you through nursing school. We have a huge nursing school curriculum that can help supplement what you are getting in nursing school. And then once you graduate, we are here to help you with your NCLEX PN or NCLEX RN. And then finally, if you decide to move on to that nurse practitioner role in the future, we can also help you in that arena as well. So lots of different programs available to guide you from start to finish in your nursing journey. And like I mentioned earlier, we have Intense Prep, which is a really all-inclusive package to really guide you through achieving either the NCLEX PN or the NCLEX RN. Do you guys have any questions for me in the last couple of minutes before we finish up today? I'm happy to answer them. If not, if you have questions, put them in the chat box. If you don't have any questions, I just want to tell you thank you for joining me today. I wish you the best on your nursing journey, and I hope to see you all around Archer in the future. And I don't see any questions popping up, so I think we will just go ahead and say goodbye. Thank you, everyone.